Raising children is a challenge under the best of circumstances. Attempting to raise children while homeless presents almost insurmountable problems. It's been associated with developmental and cognitive delays in children. So our effort has been to identify families with young children and give them an opportunity to become stably housed.
A number of years ago, we did a research project that convinced us to change our priorities to wellness and prevention. The research showed that a huge fraction of our health problems are not owing to disease, but to things like the environment we're in, personal habits like are you eating right, are you not smoking, etc. In other words, preventative measures could have a great deal to do with improving health care. Can we do more on prevention so we can do less on cure, not only leading to better health outcomes, but potentially saving money as well? Health Starts at Home is a particular initiative that the foundation is running with the support of foundations around the country. And the idea is to see if health outcomes can be improved with better housing for low-income people. And this initiative is based on research that shows that housing instability or chaos can be a major health problem for very young children.
What Health Starts at Home tries to do is take two different sectors, housing and healthcare, put them together so they can work more efficiently to impact the lives and health of more children and families.
There are actually a range of housing organizations that are part of Health Starts at Home, what we call the continuum of housing. So we have a shelter, that's the St. Mary's Shelter for women and children. We have permanent housing developers that are represented by WebsEdge, Nuestra Comunidad, and the neighborhood developers in Chelsea. These are organizations that have been at the forefront of community development in Boston and Chelsea.
WebsEdge works with the Boston Foundation and with the Health Starts at Home because we are the piece that works with the population over at St. Mary's, which is a homeless center for families and children, doing benefit screening and financial coaching with them. So we go over to St. Mary's and we provide them with financial coaching, which entitles budgeting, doing budgeting, pulling their credit reports, doing different disputes, so that way when they are applying to housing, it does make it easier for them to get these apartments and housing.
A family that is housing stable is a family that is healthy. And that is true for every member of the family. And there are barriers, especially in the city of Boston, to finding affordable housing. We're trying our best to show that when there is a team approach of an attorney and a social worker and a housing search specialist through a patient navigator, that we can actually house these clients and house them permanently so that their health outcomes are improved.
Hospitals are investing in this model because, again, housing is a key social determinant of health. And if we can stabilize our patients and our communities in good, affordable, safe housing, then they're more likely to come to their appointments, their children are more likely to be healthier, and we have a healthier community overall.
Really, the Boston Foundation has been a really critical leader in helping us plan for how to do that and then implement it and test the models in order to scale it. I think in many ways it's how philanthropy should work. You should be able to innovate and be able to create new models of care. I don't think we would have been able to do it without the Boston Foundation's support.
These intentional collaborations across healthcare and housing sectors in Boston will actually lead to improved health outcomes for young children and their families who are at risk for homelessness. We also see this as a way to catalyze additional institutions outside of our four partnerships to participate in a model such as this.
Health Starts at Home is having an incredible impact on community, primarily because first of all, it recognizes that health outcomes for children and families are directly connected to their housing stability. So by creating a program that focuses on creating stable housing for children and families, what we're doing in essence is creating healthier children and communities.